Welcome to Project First Line. Thank you for joining. In this module, we're going to review the 8 core places where germs live in healthcare. We will also discuss strategies for recognizing the risks for germs to spread from them and make people sick. Throughout this training and in all other Project First Line infection control training modules, the term germ refers to bacteria, fungi, or viruses that are likely to pose challenges to infection prevention and control. Let's begin by reviewing where germs commonly live in healthcare. When we think about germs spread in healthcare, we think about reservoirs, which are the places where germs live on and in the human body and in the environment. Germs can be found in other places, but these reservoirs are central to understanding and recognizing the risk for infections to spread in healthcare. Reservoirs found in the human body include skin, the gastrointestinal system or gut, the respiratory system, and blood. Common environmental reservoirs within the healthcare setting are water and wet surfaces, dry surfaces, dirt and dust, and devices. Understanding where germs live and how they are transferred to places where they can cause harm allows us to recognize situations when they can be spread and act to protect yourself and your patients. Now let's take a quick inventory of our knowledge about reservoirs and infection control. Turn to the blank table for body reservoirs in your participant booklet on page 2. In the first column labeled I know, jot down a few things that you know about germs and germ spread for one of the 4 body reservoirs. Next, make notes in the second column labeled I think I know about what you think you know, but might need confirmation on. If there are areas that you may still be curious or feel unsure about, feel free to jot down your thoughts in the third column of the table, what I want to know. For example, if you chose skin as your body reservoir, you might jot down that you know that lots of germs are found on the skin, and you think you know that staph is an example of a germ commonly found on the skin. Now do the same thing using the table for environment reservoirs in your participant booklet. Choose one environmental reservoir to make notes about in the table on page 2. Now, let's think about how the 2 reservoirs you selected connect with your profession in your daily work. Based on your 2 tables, create a realistic scenario showing how your reservoirs can interact with each other in healthcare, and jot down your scenario in your participant booklet. Try to think of some ways to reinforce risk recognition across reservoirs on the job and infection control actions that everyone can take to enhance safety in the healthcare setting. Now that you've had a chance to think of your own scenario, let's go over some possible options involving the body reservoirs. These are a few examples of daily healthcare interactions where germs can spread from each body reservoir. Please take a moment to reflect on each reservoir. And these are some examples of infection control actions that can be taken to prevent germs from spreading from their reservoirs in healthcare settings. Now, let's look at some examples for the environment reservoirs. Examples of daily healthcare interactions where germs can spread from each environment reservoir are listed by reservoir in this table. Please take a moment to reflect on each reservoir. And these are some examples of infection control actions that can be taken to prevent germs from spreading from their reservoirs in healthcare settings. There is so much more to think about and learn about the body and healthcare environment reservoirs, how we interact with them at work, and how we can use our knowledge to help keep germs from spreading and making people sick. We covered a great deal today, so let's recall some key highlights from the training. The places where germs live are reservoirs. Germs frequently spread between and among reservoirs. There are reservoirs in the human body and in the environment. Infection control actions are connected to how germs spread to and from these reservoirs. Knowing where germs live and how they spread is essential to help understand why infection control actions work to stop them from spreading. Thank you for your time and attention today. I hope that you can take these ideas and apply them at work. Even though we covered a lot today, there is still much more to learn. You can keep exploring these topics on your own using the resources in this module. Project FirstLine has a suite of products to help you learn more about how to recognize infection risks at work, where germs live in healthcare, and how germs spread. You can also follow Project FirstLine on social media.